Hello, my name is Janet Maxwell, but my friends call me Max, and you can call me Max. I'm running for the board because I want to see if I can help. I lived in this valley for 22 years, worked in the ski industry. I've used the hospital as a patient, and I now work there to help the community. I'm not a good speaker, I'm not a politician. I'm just a worker, and I think I can help. And I know the importance of having this hospital. We definitely have to have this hospital and have it be the best hospital we can. And thanks.
As I suggested at the beginning, I'm going to read a statement from Donna Nicely. Tanya, if you will use the same rules for me, please. First, I want to thank Michael Perry, the Lighthouse Project, and the Big Bear Chamber of Commerce for inviting me to the candidate forum. I am sorry that personal family matters have kept me from joining you this evening. I am running for the Bear Valley Community Healthcare District Board because I believe strongly in service. I have the experience and know how to get the job done. It is important to provide what our community desires as well as what our hospital staff can facilitate. This is one way I can give back to our community and its future. I want to make a difference. I have been involved in the healthcare field for over 30 years with a bachelor's degree and a national certification as a registered health information administrator. I have worked extensively in many aspects of the Medicare industry, including risk management, patient records, utilization management, quality improvement, social services, and medical staff services. My experience has taken me from small hospitals like Bear Valley Community Hospital, where I worked for 6 years, to larger facilities, Hope Hospital in Newport Beach, and St. Mary's Regional Medical Center, where I was employed for over 12 years. I have the experience to get the job done successfully. I have been a member of the community for 30 years. My son was delivered at Bear Valley Community Hospital. I have no financial ties to Bear Valley Community Hospital, just a shared community objective of improving our community healthcare facility. My focus is rather to serve on the board and facilitate positive change. I am attentive to our community's needs and desires and want to advance communications between the hospital practitioners and the community. Open forums are our ways that this can be delivered. I will bring positive leadership changes to the hospital and to the community. I believe in stabilizing management through boosting morale and confidence, patient satisfaction, quality improvement, and communications between the healthcare employees and patients. We're ready now to begin the questions. Barbara, we're going to start with you. Go down the line. The second question we'll start with Otto, so that we'll rotate around in that way. So Barbara, the first question is, each candidate has been provided with a California Code of Fair Campaign Practices statement for the candidate to voluntarily sign. This statement says that you will conduct yourself in your campaign in an honest manner without negative attacks on any candidate. Have you signed this statement? If not, will you sign it now? And if not, why not?
I did sign, excuse me. Yes, I did sign it, and I signed it at the Registrar of Voters when I registered. Yes. Willingly.
Otto Lacayo. Yes, I signed the instrument and will be abiding by it.
Sarah Rest, yes, I signed the statement.
Joseph Kelly, I did sign that, and it goes along with our small community, and we're all friends and neighbors, and that's a great thing.
Ron Mearns, yes, I've signed.
Janet Maxwell, yes, I signed.
Okay, thank you. And we'll move down the road here, Otto. And the first question is yours. The construction of the Brenda Voss Resource Center seems to be running into many unforeseen problems. If elected, how would you deal with these problems and the issue of cost overruns?
Basically, the headline in the Grizzly says we are having problems. But I think I want to say something. We have a committee that works on the planning of the new clinic, and they're diligent in their mission, and that's why we're finding that somebody forgot to tell us we have to underground certain utilities, we have to do certain things, additional costs come in. Every time you build a major project, the contractor that oversees forgets to do certain things, and it's part of the thing. In fact, our project is $3.5 million, and our finance officer has told us we could have a minor overrun, but there's nothing shocking. It's just things have to be done properly, and they came up late, and we're not really having any problems. And as far as I can see, we're on schedule, and don't see a major overrun on the cost. Otto Lacayo.
Sarah Russ. First, I'd like to state that I believe the Building the Resource Center is absolutely necessary. We do need to provide a centrally located facility and increase our services to a large percentage of our residents, and it would continue to move the hospital towards financial independence and possibly away from taxpayer dollars in the future. I do have a lot of questions and concerns about the construction process and the management of the project, just as we have all read about in the Grizzly, and if elected, I would immediately look into those and provide additional oversight, because in my opinion, that is the board's responsibility, to provide the oversight and ensure that resources are not being wasted in the construction process. We need a high-quality facility that will continue to improve upon the services offered at the hospital to better meet the needs of our community, and building the Resource Center is an important part of that. Thank you.
Looking at management in the healthcare district, it doesn't seem to be as much of a problem of finances as it does management. It looks like a mess, essentially. If you look at things that are happening, the healthcare district can't even hold on to a CEO. We don't have a CEO right now. We've gone through, what, 2 or 3 CEOs. There's other staff, upper level management that are missing. Somebody's dropping the ball over there. If you look on the website for the healthcare district, it's hard to navigate as far as the meetings. Meetings are canceled, special meetings are called with less than 24 hours notice. The meetings move from hotels to the cafeteria, to the cafeteria to the hotel. Let's get some public participation. I think one of our reporters here even pointed out at one meeting of the healthcare district that somebody was talking about doing something that would have been a violation of the Brown Act, the Open Meetings Act. The people have to be involved in all of this. It's a management problem, and when you look at a contractor who's going to build a new center, an important center like the rural health center and the family health center across from the hospital, those are important things. And when you talk to a contractor, you have to look them in the eye and say, you know, is this real, or is this a fantasy as far as completion dates and costs? Thank you.
Well, I believe it's all about follow-up and asking the right questions, making sure that you're set up with your daily, weekly, monthly plan. I think it's a 10-month plan is what it's supposed to be. Obviously, I've read the same things in the paper everybody else has. I believe a year and a half ago, it was a $2.5 million project. Now it's a $3.5 million project. And I think that it just takes the board working together. And I think we've got Rudy Shute, I think, has done a great job. He's filled in twice now for CEO, in addition to being the CFO over there. So I think if the board can give the support that they need to give, that there won't be any issues.
This is Janet Maxwell. I totally believe in this building, and it's necessary, And I do bring some different styles of life experiences and knowledge. I've been a contractor, so to have oversight, to not have noticed that you needed power is kind of amazing. So if I could help bring some knowledge to this board about little stuff like that while I learn the other stuff that I don't know, it's going to be fun. I think it'll just be good. And yeah, the building's good, and I have faith that it can be built in a timely manner. It's totally possible. And I said, let's do it. And yeah, that's all. It's funny.
I'm next.
You're next.
Oh, yeah.